Welcome back to a new episode of non-invasive ventilation, and today we're going to talk about taking care or caring of these patients as a physician or as a resident. So remember, those who we put them on non-invasive ventilation urgently or emergently for an acute events, hypoxic or hypercapnic, whatever, they need to be monitored at least in ICU or IMC. IMC or step down unit or intermediate care unit is like a level between the floor and ICU, where it's they are monitored on the screen. They have monitored blood pressure and all of that and oxygenation. So that's important. When we round on them, remember, once we put them, repeat ABG, get a baseline ABG of course, and repeat ABG within 1 to 2 hours, sometimes 30 minutes even, and readjust the settings accordingly. Try to decrease FiO2 if you can, and adjust the pressure values, the pressure support values accordingly, according to their ABG. The next thing, check for, is there any air leak and asynchrony. Is the patient having difficulty even with the bipap? And this is mainly the RT, respiratory therapist job. If there is an air leak, you may not just to tight the mask well to prevent that air leak. That means we're losing volume and losing pressure, and that will lead to a big asynchrony. That's the main really cause of asynchrony between the patient and the non-invasive pressure ventilation machine. Let's assume the patient requiring this for a day or two. They still can eat if they are awake enough and swallowing okay. Tube feeds okay. Of course, they can talk. They can get out of bed to chair. And for this, you may wonder how to eat while you have the mask. Give them a break. If they tolerate taking a break for 20-30 minutes, you can allow them to drink and eat and then put them back on that. They need, of course, we said ICU and IMC, that means continuous pulse oximetry. Now, there is some of them on the floor, like sleep apnea. They're using their own cpap. There is no need for them to be in ICU. Or chronic COPD, or who have a trilogy machine or bipap machine that they use at home, and they just continue that at home. You just continue same home settings with them. Examine them for any signs of pressure sores on their face or nose from the mask they have. This happens especially with prolonged use of these non-invasive ventilations. So these are the main thing, and of course wean as soon as possible, and we'll talk about weaning in the next episode. Thanks for watching this video. Please subscribe to our channel and activate the notification bell so you get to see the videos as soon as they are released. Glad to have you on board.